Dr. Donald Pelto, and I'm at the Greendale Physical Therapy with my friend John Duley, who works here and is the owner of Greendale Physical Therapy. Many of you that have different types of foot problems like heel pain, Achilles tendinitis, plantar fasciitis, or other types of tendon problems will probably come here for therapy. Also, those people that have surgery on their foot will have to come here, for example, for bunion surgery to increase the range of motion afterwards. And I'm going to have John talk a little bit about what he can offer here at the Greendale Physical Therapy.
Oh, thanks, Don. I appreciate that. Well, one of the things about Greendale Physical Therapy, especially in the Worcester area, is that we've got multiple locations, which are convenient to for a lot of people. We've got one location in Worcester, one location in Shrewsbury, a location in Clinton, and also for people who are up in the Boston area, we have a location in Woburn as well. One of the things that's different about Greendale Physical Therapy is we also offer aquatic physical therapy, which benefits people who are partially weight-bearing or athletes who need that partial weight-bearing and need accelerate their therapy. We see a lot of Dr. Pelto's patients, and one of the great things about that is, as you see, he's in our office. We communicate with him very well, and that's one of the number one things that helps patients long-term is good communication between the physical therapist and their doctor and the patient's doctor.
Now, I wanted to ask you, a lot of people have a question. They wonder, well, I'm going to go to physical therapy. How many sessions will I have to go to? How many days a week am I going to have to go? And will it ever end? What do you tell patients when they ask you that?
Okay. Well, it's all dependent on the patient. It depends. We do an initial evaluation with the patient, and at the time of the initial evaluation, the therapist will determine whether it's 2 times a week, 3 times a week. A lot of times, because of the technologies that we use, we don't necessarily have to see people 3 times a week like we did in the past. We're able to see them 2 times a week, and that's one of the things. And then we evaluate every month or so. And with the techniques that Dr. Pelto does, and also the techniques that we do, we can really accelerate a lot of the healing that in the past took a lot longer.
Now, if someone wants to learn more about Greendale Physical Therapy or even scheduling an appointment, they might want to know if they need a doctor's referral or they can just call you. What number should they call? What's your website?
So we have a main phone number for all 4 locations, which is 855-459-5000. And our website is www.greendalept.com. It has a lot of great information. There's also an education tab on there as well, which has a lot of information about not only foot conditions but other conditions as well.
Great. Thanks, John.
All right, appreciate it.